Welcome back. Thank you for tuning into my channel. This is Emani, and today we're going to talk about oral health. Don't forget to hit that subscribe button and like at the end of the video. These words will be used in the script today, maybe or maybe not. Halitosis is bad breath. Stomatitis is inflammation of your mouth. Debris, that's dead, diseased, or damaged tissue removed from a wound. Dental plaque, that's yellow film on the teeth that can be removed by brushing. Oral candidiasis, that's thrush of the mouth. Exrostomia is dryness of the mouth caused by decreased saliva secretion. Cheilitis, that's reddened, crusting, or bleeding areas. Tartar, yellow film that can't be removed by brushing. Dental caries, that's cavities of the mouth. Gingivitis, red, swollen, or bleeding around the gum line. Oral hygiene, keeping your teeth and mouth clean and healthy. Problems in your mouth or gums can affect the rest of your body. Your mouth carries tons of bacteria, but most of them are harmless. Your mouth can carry these bacteria to your stomach and lungs and cause disease. The mouth's primary function is to breathe, chew, drink, taste food, and talk. All of these things are helped by the lips, tongue, and the teeth or dentures. Keeping clean and well-maintained oral care is important for many reasons. It keeps the mouth and face free of pain. It decreases the chances of mouth or throat cancer. It decreases chances of mouth sores or gum disease. It decreases tooth decay and tooth loss. Certain medications can decrease saliva flow and affect the flora of the mouth, which is pain pills, depression meds, water pills, sinus meds, cough syrups. Saliva is a key player in oral care. It helps wash away food and neutralize acids produced by bacteria in the mouth. Saliva has antibacterial properties that's essential for keeping mouth infections away. Inflammation and infection can be caused by decreased saliva production, which could lead to cavities, gingivitis, or periodontal disease. You could get mouth sores, which are red and swollen areas, or a yeast infection, which is creamy white coatings or yellow curd in the mouth. Your mouth hygiene could contribute to various health conditions like pregnancy and birth complications. Inflammation of gums can cause premature birth or low birth weight. Endocarditis, that's infection of the inner lining of your heart valves and can be caused by bacteria and other germs that travel from your mouth and spread throughout your bloodstream and attach to certain areas in the heart. Pneumonia, bacteria that can be pulled into your lungs from the mouth causing pneumonia or other respiratory diseases. Gum disease, bacteria under the gum tissue that begin to destroy the gums and bone. It could destroy your teeth and you will have to get them pulled. These are some of the health issues that could be affected by poor mouth care. Osteoporosis can be caused by periodontal, tooth, and bone loss, which could affect other bones in the body. Diabetes. Your gums are at risk from diabetes because the body's decreased resistance to infection. HIV or AIDS. Painful mouth sores are common in this group of people. Alzheimer's disease can cause bad oral health as the disease progresses. Risk factors. Denture wearers have an increased risk of inflammation of the mouth, and it may or may not have ulcerations. Also, the acrylics within dentures increases your chance of getting yeast in the mouth. Poor diet. When your appetite is poor and you have decreased saliva, you lack vitamins and minerals and could eventually lead to malnutrition. Learning and physical disabilities are at an increased risk because they do not know how to brush sometimes, and they're unable to tell someone to do it. Medical conditions. You're at increased risk if you have HIV, leukemia, diabetes, cancer, and treatments like radiation will decrease protective production of saliva, which will impact hydration and natural flora of the mouth. Mental health. These people are at risk because they may not know how important mouth care is, and so their mouth care is poor, and they are unable to tell anyone that they have a problem. Unconscious intubated patients are at risk because their throats become colonized with certain respiratory germs due to poor oral care. Oxygen. People on oxygen have an increased risk because the oxygen dries out the mucosa, causing decreased saliva. Mouth breathers. This is common in unconscious people increasing the risk of decreased saliva. Older people in nursing homes have an increased risk of poor mouth hygiene because they have to depend on others for mouth care. Stress can also affect the mouth health in several ways. You can have decreased mouth care because you're too busy and forget to brush and floss, causing cavities and gum disease. Cold sores caused by the herpes simplex virus 1, which can be triggered by poor dental health, stress, and sunlight. Oral infections or sores can be brought on by stress. Decreased immune response is caused by stress. Teeth grinding can happen especially when concentrating or at night while sleeping. Stress can cause jaw issues. Disorders of the jaw joint or chewing muscles can cause pain around the ear or face. Ways to improve your oral health. Oral care is really important for your health and wellness. To maintain a healthy mouth, try to keep the lips and mucosa soft, clean, intact, and moist. Brush and floss twice daily of your teeth or your dentures, and if you can't brush within 30 minutes after a meal, chew a piece of sugar-free gum. Use mouthwash. Avoid smoking. Replace your toothbrush every 3 months. Eat a healthy diet, limiting food with a lot of sugar. Schedule regular dental checkups and cleanings. Don't forget to hit the like button and subscribe, and tune in for videos that will be posted every Friday. This has been your host, Emani. Until next time.